My presentation was on pediatric MS, diagnosis and treatment, as well as transition of care. I am just, very interested in how children who are diagnosed, usually between the ages of 14 and 17, but we do have some outliers that are a little younger, but making sure and ensuring that they transition in an appropriate manner from a pediatric healthcare provider to a adult healthcare provider, and making sure that that transition is smooth and without error when it comes to getting insurance coverage, getting the medications that they need, getting to the right providers, and understanding and having a good understanding of how their health care is impacted by the decisions that they make. And so starting them off early. And so my big topic was transition, but also just giving the other clinicians an opportunity to understand the differences between pediatric MS and adult onset MS, and how decision making can be affected in treating those individuals. Diagnosis with pediatric MS can be very challenging because there are a lot of mimickers in just the general pediatric population that may affect or impact that diagnosis. There are other disease mimickers that have to be ruled out. The diagnosis is similar to adults, where you have to do a lot of ruling out of other diseases that may primarily affect the peds population. You may have some ethical dilemmas in which you are trying to make a diagnosis, make the correct diagnosis, as well as getting a parent or a caregiver on board to take disease-modifying medications once the diagnosis is made. Other challenges involve children that are mostly, as I said earlier, adolescents that may not understand. They look good, they feel good, and they don't understand that their brain has been affected, that their spinal cord has been affected, and so we may have issues with them with adherence to medications, issues with them understanding the need for healthcare provider visits, understanding that they may have a psychosocial impact as a result of their disease. And so just getting them to understand the importance of follow-up, getting them to understand that they have long-term care needs that need to be addressed. Oftentimes teenagers take on the Superman effect. They have the hero cape on, they feel good, and so they don't understand that they've got to do lifelong treatment so that their MS keeps them, so that their meds and the things that they need keep them looking well and feeling well. A younger child that has a diagnosis, we're usually speaking to a parent. MS and young individuals under the age of 10 is rare, but it does happen. And so the approach that I take is mostly with the parent. And then as that child developmentally moves into older adolescence and young teen or young adulthood, that conversation is different. You have to bring them on board, talk to them appropriately on their developmental level, get them to understand the concepts that you're trying to introduce to them in their own language, getting them to buy into basically their health care, their own personal health care, helping them to learn to advocate for themselves as individuals, helping them to understand the importance of again, follow-up, and the importance of taking care of themselves, and not only with their MS, but all aspects of their health, so that they can live normal, healthy lives like their peers. And so really just taking a developmental approach based on their age, based on their presentation, so that they understand very early on what it means to have multiple sclerosis and growing up having multiple sclerosis. It is so important when you're transitioning a patient to adult care that you consider the patient, their caregiver, that pediatric provider, and also that adult provider. It's a team approach. Everybody should be involved, because the ultimate goal is to provide optimal care for that patient, and everyone should be involved so that everybody understands what things need to be addressed so that the transition can be smooth, it can be without flaw, and so that we promote optimal health care.